As a patient, how do you know when something that seems small for you or a loved one could actually be a red flag signaling a serious health condition? You know, we tend to be a society of procrastinators, which tends to lead to a lot of bigger health problems. So if you think like I do, that symptoms are a signal, then getting help early can make a life or death difference. In our office, we see a lot of people with aches and pains, but some conditions aren't up my alley. I also have training to spot some of the below red flags, which would suggest you go straight to the ER or just call 911. First off, weakness in your arms or legs, especially if it comes on suddenly. While this could also be a treatable disc problem or pinched nerve, if you get weak or numb in your arms, legs, or face, guess what? It could be a sign of stroke, especially if it's on one side of your body. You could also be having a stroke if you can't keep your balance, feel dizzy, or have trouble walking. So don't wait to see a doctor. Call 911. The next up, chest pain. As far as chest pain goes, I think it's better to be safe than sorry. So chest pain or pressure, it can be a sign of heart disease or attack, particularly if you feel it after being active. I know you think exercise is always good, but if your chest tightens up, listen, or if it feels heavy, lasts more than a few minutes or goes away and comes right back again, get help. Don't try to tough it out. Next up, tenderness and pain in the back of your lower leg. This could be the symptom of a blood clot in your leg. It's called a deep vein thrombosis, or DVT. It can happen after you've been sitting for a long time, like on a long plane ride, or if you're sick and have been in bed for a long time. If it's a blood clot, you may feel the pain mostly when you stand or walk. You may also notice swelling. It's normal to feel tenderness after exercise, but if you also see redness and feel heat where it's swollen, listen, again, don't wait. Call your doctor, call 911, get to a hospital. I've had good friends who've had this. Finally, wheezing, breathing problems. Listen, all of these need immediate attention, but in particular, if you're wheezing or whistling with breath, see your medical doctor right away. See, wheezing can also be a sign of pneumonia or bronchitis. So if you're coughing up yellow or green material, or if you have a shortness of breath or a fever, if you do, again, that's bronchitis, could be turning into pneumonia. Call your doc right away. So these are just 4 situations where a doc like me has training to send you out right out the door to get emergency help when you need it. And while there are many other red flags that can seem to some people like they're harmless symptoms, after your medical doctor clears you of these, then it's time for the non-invasive approach, which is what we offer. In fact, in our office, we help with a wide variety of aches and pains. We practice Nucca Chiropractic. It's a gentle, non-manipulative, or low-force form of chiropractic, and it relies on a very thorough 2-day workup, extensive exam, detailed x-rays, and a precise, gentle adjustment. In fact, a lot of our focus is on the top of the neck, because if you can get the head and neck on straight, the body can start to line up underneath. Now, of course, we do traditional adjusting as well, and we use cold laser therapy to help with pain and circulation. Additionally, our docs love speaking in the community, so we can bring the knowledge to you. We talk to local businesses, companies, corporations, church groups, community groups, civic organizations on the topics of reducing stress, better sleep, more energy, and greater productivity both at work and home. Our office is warm and friendly, and we do everything we can to help you feel at home. So call Lynn, Michelle, or me today. We can help.